COVID-19 still poses a real risk this holiday season, so celebrations may not be back to normal as we'd hoped. Here to share advice on how to gather safely this year, we welcome Providence infectious disease specialist, Dr. Tobias Pusch. Good morning, doctor.
Good morning. How are you?
Good. So how do you feel about this year's holiday get-togethers? Do you feel like we're better at this point than we were last year?
Yeah, that's a good question. So, of course, I feel better because we have better tools, right? The vaccine was a game changer really for us to address the pandemic. That being said, there's parallels. So we've now most recently dealt with the Delta wave. We've seen decrease in numbers, but yet the numbers stay stubbornly elevated at this point in time. And similar to last year, even though they were in a much better spot, just looking sheer numbers, we saw again yet another increase of numbers after the Thanksgiving holiday, and we don't see really much of a decrease, neither in total incidence right now, nor are we past the Christmas holiday yet, so we're likely going to see another uptick in infection post-holidays. How do you feel about the Omicron variant? Like, what are your thoughts on that? Like, is that going to make it worse then, obviously, this year? Yeah, this, Helen, won't touch us during the holidays as of yet. So there's many states that haven't discovered the strain yet. It's just a matter of time, of course, that every state will discover the variant. But this will likely become a problem in the months to come. So this holiday season will all be just the well-established Delta strain that's still causing most of the problems. What is your advice for celebrating safely with family and friends then? So, the main things in public health to reduce infection is proper ventilation, mask wearing, and social distancing, of course. Everybody's quite aware at this point in time, now 2 years into the pandemic almost, about these measures. To give you an example, in regards to what's most effective, it's actually to reduce the number of participants in parties. So, in infection control, the total number of contacts is very important, and then what we call contact variability. And that's hard to measure, but frequently forgotten. And when you have a large party of, let's say, 100 individuals, a holiday Christmas party from a company, let's say, you have the possibility of about 10,000 contacts. If you reduce that number to just 50 participants, you only have suddenly 2,500 possible contacts. So you reduce the population by 50%, but the number of contacts by about 75%. So it's extremely effective to celebrate with less people. Yeah, you're just in a more safe environment overall. Right, absolutely. So what do you say to the person who, the family member who says, I'm not vaccinated, not going to get vaccinated, and you're vaccinated, you should be fine if we get together? Yeah, you need to have a conversation with an individual regards not just for them to stay safe, but also exposing others. Right. So, we know at this point in time that not everybody becomes symptomatic, and they may already be infectious at the point when they expose others and don't even know about it. So I think, among family members, there should be an open conversation about that and keep everybody as safe as possible. The individual would be highly advised to wear a mask, even in the setting among family members, and social distancing, proper ventilation would be key for that type of get-together. Yeah, and I'm assuming everybody, in your opinion, should get vaccinated. The vaccine is safe and effective. Absolutely true. That can't be highlighted enough. The vaccines have been studied so thoroughly, like nothing ever has in history of medicine regards vaccinology. So yes, and looking forward to the Omicron, there's pretty good data that we have now that you got to maximize the vaccinations and get boosters to really have proper fight ability against it. Absolutely. We'd like to tell our viewers, if you'd like to find out more, you can contact Providence Health and Services. The number's on the screen, and we'll put it on our website at KATU.com. Dr. Pusch, thank you so much. My pleasure.